In addition, with low quality sampling, there's a potential to integrate data collection within the supervision system. And what I mean by this is, if supervisors who are responsible for what goes on within a supervision area by definition, if supervisors are routinely visiting the communities in their supervision area, it's possible that we could ask them to do some rapid data collection while they are visiting for other purposes. So supervisors visiting one community to observe health education sessions and meet with community health workers, we might ask the supervisor while they're there, as part of the routine work, to randomly sample, select one mother, and interview her about child health issues. And over a period of several weeks, we could collect a sample of 19 with the additional cost to the system of just being the additional half hour it takes to sample and interview a mother while they're already there as part of the routine work. In comparison, that's not something we typically do with cluster sampling. Typically, cluster sampling is not integrated with the supervision system. Typically, the whole project basically stops what it's doing and hires additional interviewers and focuses on just doing the cluster sample for a period of weeks. It's very labor intensive, it's expensive, and it's very disruptive to other program activities. With the LQAS, we have the potential to try to integrate data collection within routine work and reduce the burden and the work stoppages for the purposes of data collection. One advantage that cluster sampling has over LQAS is that it's has been more widely used since the early 90s and is more widely known. Although I think this is changing at this time, and LQAS is becoming more popular, but it is still not as well known. Certainly, or is used as frequently as cluster sampling. In this slide, we restate the advantages and disadvantages, but from the opposite perspective. Again, we can say that a limitation of LQAS is that it is less well known than cluster sampling. We can also say that typically it's more expensive to do than cluster sampling if you are only interested in program area level data. If you're not interested in information about how performance varies within the program area, then cluster sampling would be probably a more rapid, less expensive method. The limitation then again for cluster sampling, phrasing the opposite view, is that it does not identify areas or units of low coverage of performance within the program area. It only does it at the entire program area, so it doesn't give you the ability to identify a variation of performance within the program area. That's its limit. Let's discuss some of the cost issues further. You can say that LQAS typically is less expensive than cluster sampling when we do the two things. We measure coverage at the program area level, and second, we also try to look at performance within program areas. To do this with cluster sampling would require doing several cluster sample surveys within a program area, and this is not typically done because it's very costly. We also said in the previous slide that we can reduce the cost. We implied that we could reduce the cost of LQAS also if we tried to integrate data collection with regular supervision, such that the cost already budgeted for a supervisor to visit communities as part of their routine work would not be in addition. LQAS could use those resources already budgeted, and just the additional cost would be the time and energy required for a supervisor to collect and to one interview while at a community for purposes of routine supervision. So what I like to say is that really you get two for the price of one with LQAS. For the price of one LQAS survey, you not only get information about coverage at the program area level, but you also get information about performance within the program area. Now, in contrast, cluster sampling is less expensive than LQAS when only measuring coverage at the program level. So if you just want an estimate of the value of an indicator and its confidence interval at the program area level, it will be faster to do purity cluster sampling because we're basically only going to 30 sites and we're interviewing more people at one site, but most of the time and energy expense is what is required to travel to different sites. So if we go to 30 sites it would obviously take less than the 95 sites we're required to go to with LQAS. However, again, you only get one for the price of one. With one cluster sampling, you only get information about what's happening at the entire program area, and you don't get the additional benefit of understanding performance within the program area.